Yeah, I'm Nikki Schaay, and as Juliet said, it's a two-part presentation, and Hazel and Nondu, my colleagues, will do the second part. So I thought just to talk about how we said goodbye to paper, because as you know, we had a distance education program, and I actually love paper, so it's been quite hard for me to get all onto the e-learning platform. But yeah, I've been pressing a few buttons and not knowing where I'm going to go. But so I just wanted to offer a few reflections about the transition from paper to e-learning. And it involves our Diploma and Master of Public Health Distance Learning program. And let's see. So I think we were really lucky in that we had a really solid foundation. So to get online and to get into eCanva, we had this really solid base that was evolved over 10 years. So we started in 2000 and until 2010, we sort of created over 10 years like 25 modules. And that we offered in a blended approach. We had face-to-face our winter and summer schools, and that was complemented by these distance education modules that were all paper-based. And increasingly, you didn't have to come into the School of Public Health and onto campus. You could actually be somewhere completely different and get your postgraduate diploma or master's in public health. And we were one of the first African postgrad training programs offered at a distance in public health. And I think this was just the smoothest transition because we had everything ready in a way, and that really helped us. But just remembering it took a significant amount of resources to get there in a way, as I guess you realize when you go online and you have to do something and you shift away from workshops and lectures. So some of our characteristics, which I think also allow you to really flip into a learning management system and an online environment, is that all our materials were developed according to a template. They were carefully sequenced, so in terms of the content and the tasks we gave people, like I guess we all do, there was a voice of a peer. So when we sat down to write, we were actually almost like talking to our students, and that was sort of woven into the text and into the character of the modules. And importantly, we also wove in an academic skills component as well, and some tasks that students could do on a voluntary sort of basis. And we are obviously supportive of the open education resources movement, and so some of our modules are on our website and are placed there if you want to look at some examples of them. And we also were lucky in that we had an educational specialist, many of you know Lucy Alexander, that really helped us design things as content specialists. She came with an adult education lens. And we also collaborated with an Australian and UK universities that had skills. So just quickly, our postgraduate students are all, as you probably know, working health professionals. They so obviously take the postgraduate diploma and masters on a part-time level, work in a clinical setting, either as doctors, nurses, pharmacists, or in a management role in a facility or managing a program. Just interesting to note that from 2005 there was a real increase in students from other parts of Africa, and at the moment I think we've come to the realization that managing 200 students, PhD, MPH, and diplomas as much as we can manage. This is also from our latest annual report, and I guess just interesting to note is the large majority is from South Africa, and other countries that we engage with quite a bit through our students are Namibia, Zambia, and Nigeria. So they have high numbers. I just wanted to include this as a slide, and this is one of the advantages of getting online is we have been able to allow our students to connect with one another a lot more. So you saw the map of Africa and how people were scattered all over the place. And we've used the kind of, the discussion forums and the blogs online to allow people to introduce themselves. And this is one of our students, Dr. Pen Amar, who actually works in the Central African Republic, and that is different to DRC. It's above DRC and the right of Cameroon. I had to look for it. And he works for an Italian-based NGO looking at health and nutrition. And this is one of his site visits that he's paying, and community health workers are weighing a child. And what we asked students to do, and I think the e-learning platform really allowed us to keep them connected, is that we asked them to take a picture of like a day in their work, and people posted it on, and we then put it into our newsletter, and it was in the faculty news, I think. But it really provides you with a texture of how people's lives are when we can't connect with them on campus in a way. So I just wanted to also show the phases that we went through. So we've talked about the paper-based, and then for me, leaving the paper behind, we kind of went through two phases, and Hazel and Nondo, which we'll talk about the third phase. So phase one for me was around 2010, where we actually used a lot of Google, and I had to put the new colors there because I think they introduced it this week sometime. And so we had Google Sites and groups, and we started, it's almost like we dipped our toe in and got some peer learning activities together using the Google discussion groups. And one of the big things that we also did, we had a portfolio for our postgraduate diploma students, and we transferred that from a paper-based onto an e-learning portfolio. And we also did some module evaluations using SurveyMonkey. So that was sort of almost like dipping in. And then in 2014, we took quite a bold step in a way and transferred one of our core modules at an MPH level, the Management Strategies for Public Health. We sort of embedded it into a Canva and used XE. So it really was online now and with us at UWC in a Canva. And then in 2015, we've placed all our core modules on Canva, but we use them in various ways. So Management Strategies for Public Health is 2 of the 5 units are in XE, whereas my module, I kind of put the units in PDF, but I use the announcements and discussion forum and use the course resources and link to a YouTube channel. And I think one of the earlier speakers were talking, had the whole list of all the great things that are on there, and we found with discussion forums they are really amazing, and we've broken up our class of 40 into 4 groups. So we found smaller groups work really well, and so 2 facilitators take 2 groups, and so we've sort of come around come up with sort of strategies like that. Then We've done 2 small surveys in 2 of the courses over the last 2 years about our students' experiences of the online environment and what their internet connectivity is, how they like the introductory exercises and the discussions, and we can share that with you another time. But what I found interesting is that of those that responded, so for this year, 66% of our students responded. For them, it was a very new experience of studying online. So I thought that was important just to bear in mind. And then just in the last minute, I wanted to say an important thing that we've experienced. And okay, apart from the saving of being in line, and just to think about the student I introduced, Penn, in the DRC, if we send 10 kilograms of course material to him, it's going to cost him 5,600 Rand by courier, and that's his fees. So using a Canva, it's a really practical thing. We save money copying, and he saves in couriering. And you'll see a picture of Corin there, and I also just wanted to say that student administrators are so essential. And a lot of the time they're not acknowledged when we're talking about e-learning and yes. Okay, and I'll leave you with a few quotes when I asked Janine and Corin and Zianda what some of their work involved. And it really is being compassionate, acting as a counselor, understanding the realities of people's lives, and yet knowing the rules of our system. So I think that I just want you to remember, yeah, that. And this is my absolutely last slide, where there was this amazing conference that some of us attended, Emerging Technologies and Authentic Learning, and the idea of care as a core element in pedagogy was introduced. So that sort of linked with our student administrators and supporters, just bearing them in mind. They're a critical part of the team. Yeah.
Thank you. Any questions for Nikki? So Nikki, like we've always said from the time we started, it's not about the e-tools, it's about the people.
Yeah, yeah.
Building those relationships. And thank you for your efforts.